10 dog diseases you should know about. Your dog's life is made up of walks, croquettes and caresses. Unfortunately, there are also many diseases that can affect his daily life. As an owner, discover the most common dog illnesses and learn to recognize their symptoms. 1. Distemper. Distemper was first described in 1905 by the veterinarian Henri Carré, to whom it owes its name. It is a highly contagious viral infection that is similar to measles for humans. It is transmitted mainly from dog to dog by contact from one truffle to another, or by contact of the truffle with a contaminated object. Symptoms. The infection is manifested by different symptoms: high fever, sneezing, cough, discharges from the eyes, diarrhea or vomiting, tremors and difficulty in holding his head, a reduction. Treatments and means of prevention. There is no miracle cure for distemper. If your dog has it, the vet may prescribe antibiotics. However, these drugs do not cure the disease, they simply avoid the risk of superinfection. This is the reason why distemper is often fatal for dogs. Those who survive have nervous sequelae tremors for the rest of their lives. Fortunately, there is a vaccine against this dog disease. The first injection is done around 8 weeks of the puppy's life. Thereafter, you will need to perform a booster every 3 years to best protect your pet. If the cost of vaccination is too high, you can take out dog health insurance from Carrefour Assurance. With the Balance Plus formula, a prevention package allows you to cover vaccination costs each year. 2. Rabies. Among the most infamous dog diseases, rabies tops the list. This condition is a zoonosis, that is, it can be transmitted to humans by bite. However, today, thanks to vaccination, rabies has strongly regressed in France. There has been no human contamination observed in mainland France since 1924. However, the virus can still be transmitted among animals, especially when a wild animal, bat, raccoon, fox, etc., bites your dog. Symptoms. The main signs of rabies are nervous. After an incubation period without symptoms of a few weeks or a few months, the virus can manifest itself in 2 different forms: the furious form with impressive signs, screaming, itching, aggressiveness, abundant salivation and foaming on the mouth, fear of water, paralysis and breathing difficulties. The paralytic form with progressive signs, paralysis of the legs, jaw, difficulty swallowing, hypersalivation, etc. Treatments and means of prevention. Like distemper, rabies is fatal in unvaccinated animals. This is why, as soon as the diagnosis is established, these animals are euthanized to limit their suffering and reduce the risk of contamination. If your dog is up to date with his vaccination schedule, however, your veterinarian will do a booster shot to help him fight the virus. Good to know, even when your dog is vaccinated against rabies, you have to react quickly. If bitten by a wild animal, take it quickly to your veterinarian. This will help you disinfect the wound. In most cases, he will prescribe antibiotics to limit the risk of infection, and he will perform a diagnostic test for rabies 3. Tetanus. Rabies is not the only disease that can be transmitted by a bite from a wild animal. Tetanus is another very dangerous dog disease. This condition is caused by a very resistant bacteria that lives in soil, mud or dust. It also lives in the saliva or feces of certain animals. This is why a simple scratch or a bite is enough to contaminate a dog. Symptoms. Once inside the dog's body, tetanus attacks the nerves. There are then 2 different forms of the disease. The focal form, tetanus causes an involuntary contraction of certain muscles, generally close to the wound. There is also hypersalivation, or even sunken eyes. The generalized form, the infection causes rigidity of the muscles everywhere on the body, lameness, difficulty in breathing, etc. Treatments and means of prevention. Tetanus is fatal for dogs in 20 to 50% of cases. The treatment consists in administering, depending on the case, an anti-tetanus serum, antibiotics and antispasmodics. In all cases, the hospitalization of the sick dog is required. However, rest assured, cases of tetanus in dogs and cats remain rare. These domestic animals are, in fact, more resistant to the bacteria than humans or horses, for example. 4. La pyroplasmosis. Ticks are also responsible for many diseases in dogs. This is particularly the case for pyroplasmosis, also called babesiosis. Transmission of this infection occurs when the tick feeds on your dog's blood. Through its saliva, it then transmits a parasite, the pyroplasm. Good to know. Spring and fall are the two favorite seasons for ticks, which often hide in tall grass. These little beasts are also particularly present in the Rhône Valley, the Massif Central and the Southwest. So be careful when walking. Symptoms. Between 2 and 8 days after being bitten by a tick, your dog may develop several symptoms of pyroplasmosis. He is generally tired and lacks appetite. His urine is dark brown in about 50% of cases. He has a fever temperature above 39 degrees. His mucous membranes are pale. His spleen looks bigger when you feel it. Treatments and means of prevention. If not treated quickly, pyroplasmosis can lead to the death of the animal. On the other hand, if you bring your animal very quickly to the veterinary emergencies, he can recover very quickly, sometimes in less than 24 hours. 5.